back to my channel, Mental Health with Melissa. If you're new here, I'm Melissa. I am a licensed clinical therapist, a social worker, a clinical supervisor, and my newest venture, a PhD psychology research student. Hopefully, I will be getting my dissertation in soon enough and will be able to get my PhD in psychology and get some adjunct teaching in. I'm really passionate about teaching overall, and so I want to continue this journey with you by sharing some information about the LCSW exam. Please don't forget to hit the subscribe and like button. And doing so really helps me get information, mental health information out there to our communities of color and to those that are interested in the mental health and behavioral health professions. Today, we're going to be continuing on this journey of the LCSW exam categories series. And today, we're going to be taking a look at psychotherapy, diagnosis, and case management. So I'm going to leave down below my LCSW exam categories video. I've already done 2 other videos on questions on 2 of the LCSW exam categories, and today we're going to be looking at a question from the psychotherapy, diagnosis, and case management category. So if that's something that you're interested in seeing, stay tuned. Okay, so before I go into the question and the options, I do want to make sure that you know about a typo. Option D is supposed to read feelings about cancer treatment, not about dialysis. So just make sure you change that when you are reading through this, because that was a typo. It's supposed to say feelings about cancer treatment, not dialysis. I apologize about the mistake. We're all human, we make mistakes, but hopefully you can incorporate that into the options. Now let's get back to it. All right, so if you have been watching my videos, you know the drill. What I like to do is read the question, break it down, and then go over the options. So I am a really big proponent for different types of learners. Some people are more visual learners, some are more auditory learners. So what I suggest is, if you're a visual learner, then pause and read the question here. If you're more of an auditory learner, then you can listen along as I read it. Or if you're both, you can do both. So after I read the question, I want you to pause the video and then read the question again, and then look at the options. Choose the answer that you think is the correct answer. Maybe write down a sentence about why you believe that that's the right answer. And then you can compare your correct answer or your answer to the correct answer and listen to more of my rationale behind that. Okay, so let's get started. A client who has received services for several years in a cancer unit appears for a routine visit. The nurse notices a markedly changed affect and refers the client to the cancer center social worker. When seeing the social worker, the client seems detached, self-absorbed, and tearful. The social worker should first assess the client's. And now we have the options. So before we break down the options, let's go ahead and break down the question and the vignette. If you've been watching my videos from the past, then you know that it is very important for me to break down the question and the vignette, because as I always say, you will find the answer in the question and in the vignette. So let's take a look. A client who has received services for several years. So let's go ahead and take a look at this. Several years. Okay, so that lets us know that this is not a new diagnosis. This client has been receiving services at this medical cancer center for several years. Okay, so this is a cancer unit. Appears, we're always assessing and evaluating as clinicians. So appears is a trigger word for us. Appears for a routine visit. Interesting. Okay, the nurse notices a markedly changed affect, a changed affect. That sounds like a really important thing for us to make note of. And then they're referred. And then when seeing the social worker, the client seems detached, self-absorbed, and tearful. So we want to make note of this because that lets us know that the client is appearing emotional. So this is something that we want to definitely notate. Okay, the social worker should first, and If you have not yet watched my video on 3 things that you need to know to pass the LCSW exam, I will link it below. A lot of the LCSW exam questions are going to consist of these first, best, and most questions. So this is a very pertinent and important keyword here. And as you can see, it's even capitalized, so first. So what this tells us is that there may be other things that we may think are important to do in this given scenario. However, the test wants to know what the social worker should do first, not second, not third, but the very initial step. So now let's take a look at the options now that we've been able to break down this vignette. Option A, life situation and recent changes. Option B, compliance with medical care. Question C, concerns about dying. And option D, feelings about dialysis. Okay, so if we take a look at option A, life situation and recent changes. Now, this sounds like a pretty reasonable response. Why does it sound like a good response as the first option? Because if we take a look at this vignette, we see that this is not a new client. This is not a new patient that has just been newly diagnosed. They've been receiving services here at this unit for a very long time, for several years, not even just a year, but more than a year. So the nurse knows this patient and is able to evaluate that there's a change in their affect. And so that may tell us something. So this option, life situation and recent changes, this could very well be an option for us to choose. But before we go ahead and make that decision, let's review the other options and break them down. Option B, compliance with medical care. So has this client and patient been receiving care? There's nothing in this that tells us yet that the patient is non-compliant with medical care. It says that they've been receiving services in the cancer unit for several years, but there's nothing in there about non-compliance. So would that be the first thing to assess? We may certainly assess it later down the road, but the first thing, I don't know about that. Let's check out the other options. Option C, concerns about dying. Now, again, as I mentioned earlier, this vignette in question is going to include a lot of important information. Is there anything in here that tells us that the patient is concerned about dying? It appears here that they're detached, self-absorbed, and tearful, but to make an assumption that that means that they're concerned about dying, and just to say that flat out the gate, would really probably break that rapport, because that would be making an assumption about them when they don't even mention that in there. So that doesn't really seem necessarily appropriate. Option D, feelings about, this is actually supposed to be cancer treatment. Made a little typo there. Sorry about that. We're all human. So option D, feelings about cancer treatment. So what does that tell us? Feelings about cancer treatment. So again, if we're looking back here at the question, it's interesting because this patient has been receiving services here again for several years. That's why this was highlighted. They know this cancer unit. They understand the treatment. Again, this is a very key word here, routine visit. They know the nurse. So the feelings about cancer treatment seem like that would be something important to know probably early on. And so will it be important to assess? Most definitely. However, again, if we're looking at this really important key word here, first, then we know that the first thing that we want to assess is probably, again, A, life situation and recent changes. Because if this is a notably different affect and presentation that this patient has, and the nurse has been seeing this patient, and this patient has been coming here for several years, then maybe something has changed. And so the first thing that we're going to want to assess is what's going on. What is going on with this patient? Have there been any recent changes? And we want to make sure that we can make those questions open-ended and really meet the client where they're at. as social workers, we really want to make sure that we approach clients where they're at. Person-centered care is first and foremost. So your answer is going to be life situation and recent changes. So I hope that made sense. If you have any questions at all, please leave them in the comments section below. So this would probably go under case management and psychotherapy under this category, as you're providing case management services and therapeutic interventions. So thank you so much for watching. Again, please don't forget to hit that like and subscribe button for more content like this. My next video is going to be likely another video on the LCSW categories exam series, and somebody also commented and requested a video on group therapy, because there are questions about group therapy on the LCSW exam series. So I'm really excited to also do a video on that, as I have a lot of experience doing support groups. Until next time, don't forget, managing mental health matters.